since you started your career as a transplant as a transplant cardiologist, what has been the biggest challenge that you think you've had to face when it comes to access to advanced heart failure and transplant services for your patients?
So I would say it's financial, even not necessarily when you get to VAD and transplant, but even with bread and butter heart failure. So now we have like two classes of guideline directed medical therapies that are amazing. We, talk about them, we tweet about them. We know they reduce mortality better than the old school drugs. So I'm talking about ARNIs, so sacubitril valsartan. I'm talking about the SGLT2 inhibitors. But when you're talking about access, again, the copays are sometimes unaffordable to patients. And I know the companies have coupons, they have patient assistance programs, but even then, not everybody is able to get through those hoops to get access to those medications. And then specifically to answer your questions about advanced therapies, people are always like, well, if you're sick, we're going to transplant you. But no, you go through this psychosocial evaluation and finances come into play. Your psychosocial support, your psychosocial evaluation comes into play. And what I mean by financial is even if you do have insurance, the copays for some of the post-transplant medications are high. But also a financial decision has to be made if, say, I need a heart transplant and my spouse has to take time off work. And then now we have young kids at home. Who's going to take care of the kids? We have to put them in daycare. So that becomes a financial burden. But also lots of transplant centers expect patients to live within a certain mile radius post-transplant. And so now I'm asking somebody who might live way up in Maine to now move to Boston for 3 months post-transplant because we want them close in case something happens. So not many people can afford housing in Boston in addition to whatever housing they're paying for at home. So lots of financial considerations come into play when we're deciding who gets to get a transplant or an LVAD and who doesn't.